Hello! Good morning from Oklahoma. And good evening po sa inyong mga nanonood dyan sa Pilipinas. Okay, so another winner.
Karen
Ann Boyer.
You
Yes.
just won.
I think she was the first one last time
that
as
girl's
well.
quick on the draw, Mama.
Yeah, I don't know what Karen is doing right now, but
She's standing by to win.
she's kicking Sean Krisha Testado's butt. So, hello po sa inyong lahat. Julie Sapuay is watching. And of course, Mike Joseph watching.
Nick Vargas.
Hello, Sir Nick. Yes. So, one of our distributor in Australia. I will tell all of you who these people are so later. So, Miss Lori Garcia is watching as well. Hello, Miss Lori. Of course, she's my very good friend. Yeah. Si Kitty SP is now watching in. Ayan. So, salamat po sa mga nanonood, but hindi ho kayo nanalo. You didn't win. That was Karen Ann.
Karen Boyer, sorry.
Yeah, so congratulations, Karen. So, before we start, let's do a disclaimer first.
Sure. And the watching and interacting with this video does not constitute or initiate a doctor-patient relationship with Dr. Farrah. The information being provided by Dr. Farrah should only be considered for education and entertainment purposes only. If you feel that anything you see or hear may be of value to you on this broadcast or on any website or other medium of any kind associated with Dr. Farrah, you are encouraged to and agree to consult with a licensed healthcare professional in your area to discuss it. If you feel that you're having a healthcare emergency, seek medical attention immediately. The views expressed here are simply the views and opinions of Dr. Farrah and myself and are protected under the First Amendment. Dr. Farrah is a highly experienced, Harvard-trained medical doctor, not some blind enthusiast promoting the wild and unrestrained use of nutritional products for health issues without evidence of therapeutic benefit. She has personally and keenly studied everything she recommends, and more importantly, she's closely observed the reactions and results in a clinical setting with patients countless times.
Okay. Thank you, Sir Jack. That was such a nice disclaimer. You know, Sir Jack is such a good writer. She's one of the best writer I have ever had in my life. Better than me.
Are you giving me writing credit now, Mom? Huh?
Better than me,
You
okay.
give me writing credit?
No,
Wow.
better than me. Yeah. So, before we start, I wanna do some few announcements, okay po, dun po sa mga Pilipinong nanonood dyan, and to all the Filipinos everywhere, all around the world. So, we have drfarrah.com, it's live, bostonc.com, amazon.com, and if you are in Phil, of course, my good friend Glenda Victorio.
Who can now be found at bostonc.ph.
Or also at their website, drfarrah.brilliantskinessentials.ph. Okay?
Or bostonc.ph.
Yeah, or if you cannot contact their website, you can private message Elijah C. Cruz. And of course, Brilliant Maribeth. Yung mga yan, they're always there. They would always entertain.
Don't forget Amazon.com,
Yes,
our very good friend.
Mimi. Yeah, I already said that in the
I'm
first.
sorry. Half deaf, you know.
Just stay there. Listen.
Just look at
Listen,
it.
boy.
Yeah.
Listen. So, Gil Matani, last time I forgot, Sir Gil
Sorry,
Matani. Yeah, I'm so sorry about that. But he's a distributor in Hong Kong, China, and in some parts of Asia, particularly Malaysia, Indonesia, sometimes Singapore and Japan. So if you're in those parts of the world and you wanted to try the Dr. Farrah brand, so please private message him. He's also a good man. You know, it's just unfortunate that many things are happening in Hong Kong, di ba? So, it's heartbroken. We're heartbroken, disheartened. Yes. So, of course, Nick Vargas from Australia. So, if you're in Australia, Oceania,
G'day.
or New Zealand, can you do a
G'day.
good day?
Good day.
Down under.
G'day.
It's like down under.
I could do much better than that, but right now I'm using one of Dr. Farrah's. We're testing out a formula right now for a cough drop because I was fortunate enough now to catch a flu.
Yes.
So I'm trying out one of her formulations
We'll
as a cough drop.
Yes.
It's working pretty well right now.
Okay, so if you're interested you're in that part of the world, please say hello to Sir Nick Vargas. Yeah, he's a good man also. And in UK and in Europe, Switzerland, Germany, you know, what else? Finland, So
Well, there's lots of countries there,
those
Bob.
part in UK, not in UK, in Europe and in UK. So please private message Butchoy Amor. He's a good man also. Yeah.
Hello, Ate Bev Salviejo.
Yes. Hello, Ate Beverly. Yeah, we miss you already. So again, if you're in Hawaii, the distributor is Elizabeth Sante, and in some parts of the US as well. And in the Middle East, yan, sa Qatar, Dubai, Abu Dhabi, and you can go see Arceli Culaban. Okay, so she's still doing some of her paperworks, but we're getting through. So hopefully it will be done soon. Yan. So today is Black Friday. What's Black Friday, honey?
Black Friday is the day after Thanksgiving in the U.S. It's a day of very, very big savings as far as places to shop are concerned. And Dr. Farrah is no exception.
So we're offering 20% today for Black Friday up until
Cyber Monday.
Cyber
You simply have to
Monday.
use the savings code of THANKFUL.
Yeah, so
THANKFUL.
if you're interested, yan, punta po kayo dyan sa drfarrah.com. So you go there, 20% po. Okay, today and up until Monday.
Through Monday, which is known as
Yeah.
Cyber Monday.
So, well, Thanksgiving. Thank you po sa mga bumati sa akin ng Thanksgiving. Yan, Ate Beverly said hello daw.
Hello, Ate.
So, salamat po sa mga bumati sa akin ng Thanksgiving, but I do not have any Thanksgiving. But thank you for always putting me in your mind. So, I really appreciate that. But do you remember, honey, when you used to
Yeah.
celebrate Thanksgiving? Yeah.
I remember my first Thanksgiving with you in the Philippines, and I said, I want some turkey. I really, really want some turkey. And so she took
Some
me...
pie.
And some pie. So she took me to Jollibee and got me some chicken and a peach mango pie.
Yeah, so, diba? Social, yeah. But ngayon, no, because
Better
we do-
than nothing.
Yeah, but we do not celebrate Thanksgiving because we had a different religion back then and until now. So ngayon po, hindi na po kami nagsiselebrate. But thank you very much, yes. So to my angels, of course, Kenjaya, Evangelista, Mikmik, yan, si Princess, Sheila, Goten, Goten Collado, who else? Kay Jewel,
Evangelista.
and Chris. Yeah.
Chris Aries, Vincent.
Chris Aries. So these are my angels. Okay. So our second book, malapit na po yung second book namin. So it's almost out. So it features kitchen remedies.
Final edits right now.
Yeah, kitchen remedies of various disorders and maladies. So kapag ka nakagat ka from, halimbawa, nakagat ka ng aso, you don't know what to do. Nagkaroon ka ng food poisoning or constipated. So whatever it is, you can always find some of the most popular home remedies or kitchen remedies in your kitchen, so in your pantry, di ba? Social. And of course, the book also features like toxic homes.
Yep.
So dun po sa mga tao na interested on getting a lot of house plants, there's tons of house plants there. A lot of advices also with regards to how are you supposed to keep a clean house. So what are the substitutes for cleaning agents, diba? So minsan tayo, basta bili na lang, pag may pera, bibili ka na lang dyan, diba? So bili na lang tayo ng ganito, ganyan. So with the second book, it will tell you what type. It will tell you what type or what you can do also to concoct your own cleaning agent.
Correct.
Safe cleaning.
Very
agents.
comprehensive.
Yes.
Lots of pages.
Yes. And of course, one of the last announcement is my multivitamin.
That's right.
It will be coming soon. Okay, not right now.
We're hoping we can announce it today,
Yes.
but it's in production right now.
Why is it one of the best?
Because it is literally about as comprehensive as you're ever going to find, and it also includes superfoods. So we did our work on that one.
And it's
Because
organic.
It's clean. I simply, like you had told me when we were putting this together, we're not going to cut any corners, and we're not going to cut any corners. People deserve the best, and that's it. That's the way it is.
And it's organic. That's the best thing. It's organic. Hindi ho siya katulad ng iba na they usually it's most of the multivitamins that you see in the product that we're supposed to launch is that came from plant as well. So yung pinaka-importante, it's all plants. Okay. So thank you very much. Okay, so I just want to say hello again to Miss Linda Begonia, yes, watching from Wisconsin, Omro, Wisconsin, yes. Mel CG, hi po Dr. Farrah and your husband. Yes, Rich Ong, saying hello. Doc, miss you po. I miss you too. Anna Marie Ekaran, watching from Dubai. Yeah. Is it cold in Dubai right now? Have you been there?
I've never been there.
In December?
In December, no.
Ah, malapit na. Ay, nga. Today is December or?
No, today's still November.
Ah, November. November 29?
Yeah.
Ah, okay. So, Mary Rose Sale, I'm watching from Butuan City, Caraga region. Yes, and Graciel Pakleb Mauricio saying hello po. Meding Liena Artsok, yes. And Alice Di Jose, yes. Ate Alice, sa wakas. And Jolene saying hello po, Doc Farrah. And of course, my good friend, Fee Marie. Yan. So, and Norlene. So, these are all the people that are watching us right now. So, thank you very much for watching. Okay. So, as a continuation for last week, right? We talked, last week, last FB Live, we talked about cancer. Okay, and what are the treatment options that you want to do, and what is it that some of the things that you can do once you decide you have two treatment options, once you decide if you want to do chemo, radiation, or just basically conventional, and you want to go into natural. Okay, but there are
again, remember, some people choose to do nothing.
But then you have so what are the things to ponder right now? So I mean, you chose a treatment. Okay, for me, like me, I don't want to do chemo. I don't want to do surgery. I don't want to do operation. So what am I? So I'm opting to go to natural therapy. So what are the things to ponder? Number one is that there is no such thing as 100% guarantee.
There's not 100% guarantee on anything other than the fact that we're going to all die someday.
Yeah.
You know.
Like chemotherapy.
Like for example, when it comes to chemo or surgery, I can't tell you how many times you had patients come through and they'd have a mastectomy or even a double mastectomy, and they tell the patient, we got it all. And then 6 months later, the patient's dying of liver cancer. That's not bad luck. That's just the nature of cancer due to circulating tumor cells. And then whenever you have a significant surgery or injury to the body releases growth factor molecules to stimulate mitosis. And the circulating cancer cells get that signal as well, which is why surgery can often be a precursor to metastatic spread.
But there was a research or an experimentation that they did in 2002 about chemotherapy, about the efficacy of chemotherapy.
That was an extensive study from the Journal of Clinical Oncology.
This was in Australia. They did it in Australia and in the US, and the result was very not so promising. It's only 2%.
It demonstrated about 2%, and that was the effect as far as adult onset cancers are concerned, which are the majority of cancers that people see. Now there are a few that it appears to have a very, very good result for, but those are very, very limited. The majority of cancers, adult onset cancers, chemotherapeutics have an efficacy of around 2 to 3%.
So 2 to 3% lang. So like that, there was a research or an experimentation that happened like that. It was a big study. And
meta-analysis.
It tells people that it only has an efficacy rate of 2%. So 2% lang yung success rate niya. So you have also to be careful if you make an analysis. Or if you make a decision on which treatment options you want to go. Like, if you're also gonna go in natural, hindi naman lahat yan 100% eh. Kung may mga success rate, of course, there's always gonna be success rate.
Yeah.
But there's also gonna be failure rate. You just have to be realistic.
Be realistic.
It doesn't mean that if you undergo the treatment, you completed it, that you are 100% cancer-free. In fact, the second thing to ponder is that there is no sophisticated medical equipment that will tell you that you are cancer-free. So, you can do all the testing that you want. Nagpa-cancer testing ka na. You did PET scan. You did CT scan or whatever it is that your doctor would tell you. O sige, magpa-laboratory ka. And then it's all negative. And then after 5 months, after 3 months, magugulat ka na lang. It's positive already. So, pumunta ka sa doktor mo, you're gonna say, Doc, what happened?
Well, basically, at that time, you were free of detectable cancer, utilizing the means that are available. And the means that are available cannot detect every bit of cancer within the body.
Because these are microscopic, you have to understand. So the cancer cells are microscopic. And the most, like what I said, most sophisticated medical equipment in the world cannot tell you if you are 100% cancer-free. So magugulat ka na lang after 5 months, di ba? May cancer ka na naman. And it's already stage 4. So, cancer is a very sneaky disease, okay? So, do not take it lightly.
No.
Okay. That's why on our third things to ponder is that it's very important that prevention. Yan. You focus on prevention. What was the proverb that they say? Like a pound of...
An ounce of prevention is worth a pound of cure.
So an ounce of prevention is more than a pound of cure.
Worth more than a pound of cure.
Yeah. And it's very important. That's very important. Kasi pag nagkasakit ka na, di ba? O sakit yan sa bulsa. O sakit sa ulo. Sakit sa lahat. I was telling them that if you get sick, it's like, that's a bigger problem.
Oh, yeah.
Yeah, so you have to do your best right now.
Financially,
Yeah.
Mentally,
Yes.
it's debilitating for folks. I mean, so the thing is, like for example, if you're a cigarette smoker right now, you may not be sick right now, but consider, if you will, the type of turmoil you'll put your family through if you develop lung cancer or emphysema or COPD. So the thing is, I know it's difficult to quit smoking, and I can say that because years ago I was a smoker. I stopped smoking back in 2001 after having smoked for 16 years. And so I can attest to the fact that smoking is very, very difficult. But I can also declare that I'm no better than anyone else out there. I'm just a man, and if I can do it, anyone else can do it.
Oh, yeah.
It's just a matter of determining that your health, your body is more important than that addiction to nicotine. And understand, you'll make 1,001 excuses why you don't want to quit, because you love it, you enjoy it, it relaxes you, it calms you. This is a deadly, deadly device that is simply, cigarettes are nicotine delivery systems. That's all they are. And they are very deadly. So make the determination to quit and stick to it, because if I can do it, anyone can do it.
So, Sir Jack is saying that some of the devices that we developed, there's some form of addiction that is associated with that. So, but don't be disheartened. Yan. Because always have a positive mental attitude, because you can always change. Pwede naman yan, pwede ka namang gumaling, sa addiction mo. Like Sir Jack is saying. Okay, so another things to ponder is that treatment modalities, they vary from person to person. So, halimbawa, si Juan, gumaling si Juan because of a dietary modification. Pwedeng si Pedro hindi gagaling. Okay? So, bakit si Juan gumaling? Bakit si Pedro hindi gumaling? Sometimes the body reacts. Okay? Like with certain types of drugs. Okay? Like when you go to a doctor, to a physician, they prescribe you some antibiotics. Sometimes when you drink it, it's effective, but for some people, it's not effective.
Right.
Because of our biochemical differences. Yeah. So, meron tayong mga pagkakaiba-iba sa katawan natin. So, you have to be realistic. I think some people, they're not that realistic. Okay? So, we always tend to look at other people rather than we look at ourselves. Okay? So, hindi minsan na kapag binigyan ka ng gamot, hindi because nabigyan ka ng gamot, that's 100% already. No, hindi po. So, those are just some of the things to ponder. Okay? So, do you have any quiz for them, honey?
Yeah.
Okay,
matter
for
of fact,
5,000 pesos.
For 5,000 pesos.
Yes.
And everybody should get this one. Okay. And all I'm looking for is the last name. You don't have to give me the first name, even though I do know it. Who is the only Philippine president to perish in a plane crash?
So, who is the only Philippine president na namatay daw sa plane crash? Okay. Late na naman daw si Margie B. Yes. Yeah.
Answer quickly. Last name only for 5,000 pesos.
5,000 pesos. Sino daw po ang Philippine president who
Perish
died?
in a plane crash.
Yeah. No, mali po. Yes, Mitch Nogales Ignacio. Wow. Yes. Congratulations, Mitch. You won 5,000 pesos. Wow. Yeah. Si Kyla, she doesn't know that.
I'll be looking for my message after this Facebook Live
Yes.
to collect your winnings.
Yes. So, hindi nanalo. Sorry, Tara Bunch.
Sorry,
You did
Tara
not
Bunch.
win.
Yes.
But all of you, they know it already. Ramon Magsaysay. He's very famous. You
How about a
know?
little bit of news,
One of the most loved people. Yeah. No, I want to talk about herbs.
All right, you talk
Yeah,
about it.
because a lot of people are asking me about herbal remedies, diba?
Okay.
So, but we'll do about I wanna discuss about the history of herbal medicine first.
Because I got a news piece I'm dying to share.
Yeah, we're gonna share that news later. So I wanna do
All right.
I wanna do some a short. It's just a short history of herbal medicine.
Sure.
Ever since the world started, okay, diba? So lahat naman tayo nagkakasakit. And even back then, the people back then, they were getting sick. And they discovered how to harness the therapeutic properties of plants. And this happened ever since Adam and Eve, in the Bible, And you can see, if you look at the Bible, you read it, there are tons of people like King Hezekiah when he was sick, he had a lot of sores in his body. Job, he had sores in his body. There are tons of people back then. They were using tons of herbal remedies. And back then, because we are scavengers, sabi nga nila, so some of the people, they're scavengers. So what they would do if they are sick, they would smell the plant. They would crush it and smell it. And if they have a strong scent, most probably those plants have therapeutic properties. So, kayo po mga tao dyan. So, if you wanna try it, go outside. So, if you're sick or just walking, so if you see a plant and if you wanna know if it has a therapeutic property, just go out, crush it, ganun niyo po sa kamay ninyo, and then you smell it. And if it has a strong smell, most probably, it has some therapeutic value.
Continue to further research it and just don't start eating and foraging as you're out there in the jungle.
Yes, but some also, that's why Jehovah was, I think he's a great engineer. He had us all of the senses, and we have, we are being bombarded with senses left and right. So if you see a plant and then you taste it, and if it's bitter, most probably that's toxic. So do not taste it. Something that you do not know. But of course, some of the plants that are bitter, you know it already. Like ampalaya, di ba? Hindi naman toxic ang ampalaya eh. But if you are outside and
Bitter
then...
gourd?
Yeah, bitter gourd.
That doesn't smell good at any point.
Yeah,
or tastes good.
But what I'm trying to say is that if you know that plant and you have been eating that plant, and it's safe to eat that plant. But if you're outside and you're foraging, and then there's a plant that is bitter, more or less, it's toxic. So do not take it. It has alkaloid on it. But if it has that minty taste, most probably it has a therapeutic value. Now, if you're gonna use herb as therapeutic for its therapeutic properties, you have to use it 5 to 7 times higher than the normal, because a lot of people are doing herbal medicine, but the thing is, it's not working for them. So probably you are using a small amount. Konti lang siguro yung ginagamit ho ninyo. So now, if you wanna use, if you wanna harness the property of that, you have to use it 5 to 7 times higher. Ako po, pagka gumagawa po ako ng herbal medicine, I'm drinking it, I make sure it's I get a big handful. So big handful na ganyan. So that's around 5 to 7 times higher already. So yun ho ang aking measure measurement to see if they have the therapeutic value that I need. So, I boil it or I chew them. So, depende. Depende po dun sa preparation that I'm making. And then, I drink them. Now, you can drink it 3 times a day. Okay lang po yan. 3 or 4 times a day. Hindi naman ho kayo madidisgrasya sa mga ganyan. Like garlic, okay lang naman yan. Now, some pregnant women, okay, they are cautioned not to take herbal medicine. Because some of the herbal medicine may have an adverse reaction dun po sa baby. That's why if you ask us, okay, if you ask us and also my staff, we always tell them, if you are pregnant, wag muna. Okay, don't take herbal medicine. Okay? So, uulitin ko po. So, if you are pregnant, wag muna. Then, after you deliver, then that's the time that you take it. Okay? Even with nursing moms, sometimes we tell them, wag muna. Don't do it yet. Okay? So, after everything has been done, tapos ka na, hindi ka na nag-nursing, then you can start your herbal medicine.
And that's just simply because there hasn't been a randomized control study to determine exactly what could or may happen in that instance. And we really prefer to err on the side of caution.
Yes, okay. Hello, Miss Lisette L.A. Yes. She's the beautiful wife of
Gestoni
Alarcon.
Philippines superstar.
One of the best people that we have been. Very kind.
Nice people.
Humble, especially Kuya Jess.
Oh yeah.
He's very humble.
That's Lizette as well.
Yeah.
Wonderful people.
So, they're good people. Hello, Ate Lisette. Yes, Rick Lons is watching. Sir Rick, na-miss kita. Yan. So, Chona Monterde is saying, good evening, Doc Farrah. Hello po. Good evening po sa inyo. And Laydell Earth is watching. Yes.
So, can I cover some news?
Oh, yeah. Sir Jacka's news.
All
Okay, let's listen.
Okay. First of all, in June of last year, at the approval of Francisco Duque, the DOH secretary, there was a closure order on our facility that was done illegally without jurisdiction, and it was posted on the DOH website in June of last year. We knew that this was the wrong thing to do, and so we had attorney Sig Fortune sue the DOH and Francisco Duque. Guess who just settled, Mom?
Yeah, the Department of Health. So they just settled. So it's a win for us.
They also paid an undisclosed settlement.
Yes. So the Department of Health paid us for the illegal closure of our
illegal
facility.
closure.
Yes. So but we cannot disclose the amount.
No, unfortunately.
Unfortunately. But it's a good win for us.
The thing is most important is it's a win.
Yes.
They acted with malice. They acted wrongly without jurisdiction, and there's still a few others that we're tangling with.
Yeah.
But it was nice to get a little bit of justice, just a little sniff of justice.
Yeah. So Chrissy Russell is asking what's good for constipation. So there are different causes of constipation. So one of the causes can be your diet. So most probably you're not eating foods that are rich in fiber. So that's one of the reason why a person can be constipated. Second, if you have a tumor, okay, like some tumors in the colon, yan, pwede ho tayo magkaroon ng constipation. Second is because we're not drinking a lot of fluid. So that's another one. That's another reason why we would develop constipation. Now, what are the things that you can do to prevent constipation? Number one is that you can drink olive oil. Yeah. So olive oil, virgin coconut oil, alugbati, spinach, green leafy vegetables. These are the things that can help you move. Yan. Or masaya na silang lahat. Kenjaya Evangelista said, wow, yay!
Someone wants to say hello.
Annalyn Corilla said, wow, congratulations. So those are one of the things that you can do if you are constipated. Yeah. Damihan mo lang. Like with olive oil, you can drink 120 ml. For the virgin coconut oil, 1 tablespoon or 2 tablespoons. Hello! Yes! say hello. Marcia Moreno is asking, so you can come back and fill right now.
Not yet. I understand. We had the reason why we had to flee, and I'll actually be releasing that online here shortly. All the documentation of it is we had received a significant number of death threats that were attributed to senior FDA enforcers by NICA, and those were not investigated by the PNP. Despite the fact that they were turned over to PNP, there was absolutely nothing done because at the time, PNP was getting significant funding from FDA, and so they were not going to investigate or bite the hand that feeds them. So it was not safe at that point, and is currently, I think, still not safe for us.
Yes, okay. So another is, hello po Doc Farrah. Ano po ang mabisang pang-detox galing vaccines kay baby? 8 months po. Salamat, Christine Janet. For detoxification, you can use horsetail tea. Yeah, so horsetail tea, because some of the vaccines, they have aluminum, one of the components of them, they have aluminum, and then the silica from horsetail, it will combine with the aluminum, and then you can safely pee them. Yan. So one of the best way you can remove the harmful chemicals inside your body. Pwede din po yung vitamin C. Yan. That's one of the best thing that you can do as well. Yes. Any more questions?
Yeah, let's go to some Q&A now.
Yes, remedy for falling hair. Yeah, so one of the remedies that you can do for falling hair is that castor oil. So you get a castor oil and then you just massage them in your scalp. Yeah, usually at night. You can do that at night, and then overnight, and then you wash your hair after that. Also, virgin coconut oil. That's one of another remedy that you can do for falling hair. And you have to eat tons of food that are rich in protein. So the proteins, they're eggs, meat, lentils, mushrooms, yan. Maganda ho sa buhok yan. Because the hair is generally, it's a dead protein. Yan.
Christopher Kamalong Bakuel asks you, Doc, as World AIDS Day is coming up for our countrymen, what is the best herbal medicine to boost immune system and to fight infectious diseases?
Yeah, you can do echinacea. So echinacea is very notorious. Yan. So notorious in fighting infectious diseases or increasing your immune system. Now, if you're leaning towards the minerals that would enhance your immune system, the best is zinc. Yan. So if you're interested with zinc, it's found in nuts, in oysters, and in some green leafy vegetables as well, so they can enhance your immunity. And of course, you have to have because like some infectious diseases, most of them, it's also in lifestyle, so you have to practice a good lifestyle as well. So sexual activities, yan, you have to be monogamous, yan, isa lang. One only, your one and only. Do not be an adulterous person. Yes. Okay. So if the patient is undergoing chemotherapy, can she use herbal medicine at the same time? Of course. But some doctors, they will tell you, do not use it, you know. So some of them also, they will also say, do not use vitamin C. But you can. There are tons of research on certain types of herbs that actually increases the efficacy of some chemotherapeutic drugs, like garlic and ginger. They enhance the effect of some chemotherapeutic drugs. You can look it up. Madami yan. Lalo na ang garlic and ginger. They're the most researched, one of the most researched herbs in the entire world. Yes.
What can you say about taking celery juice every day from Burns Bacamonte?
Celery juice is good. Yeah, you can take it every day if you want. But
Doesn't taste
again, juicing, you have to understand, Jehovah, in all plants and fruits, there's a fiber there. So when you do juicing, you just remove the fiber. And the fiber is there for a reason. The fiber is there for a reason, to keep us full. Okay? Like in one of my books, I told people about juicing. Like if I tell you, Sir Jack, you eat 20 apples.
I could do it. It'd be very, very difficult.
It was very
It'd
difficult.
be very difficult.
Yeah.
I could do it.
But some people like me, I cannot even eat one apple, 1 or 2 apples. Hindi ako masyadong.
But it would be hard.
But
It'd be
then
hard.
the fiber keeps us full.
But yeah, drinking the juice of 20 apples, no problem.
Yeah. It was created for a reason. Okay? It was put there for a reason because excess fructose, excess sugar is bad for us. Now the fiber fills us up. And it's also, the fiber is also the food for some of the microbiome in our gut.
Hello, Aiden Flores.
Yes, okay. So next is, what is it?
Quinoa as rice substitute.
Okay, I have not done tons of research about quinoa. So if it's a lot of people are asking me about it, but most of the grains, they are highly inflammatory. Like oats, oats, corns, na highly inflammatory yung mga yan. So if I were you, okay, and if you're not a cancer patient, you can eat it, quinoa, yeah. But if you're a cancer patient, I don't advise yet until I do my research because I have not done tons of research on quinoa. Okay, but if you're not a cancer patient, you may eat it. Yes. Again.
Don't be in a hurry to replace rice. Because understand, you cannot get healthy with the type of lifestyle that gets you sick. And so if you still insist upon eating rice or eating something just like rice, that's not good.
So Dre SP is asking that she feels a lump on her right breast. Yan, hindi daw siya nawawala. Just go there and talk to them. Yeah. Hindi daw siya nawawala since January. Yes. Hindi naman po lumalaki, but I feel concerned. What can you recommend, Doc? Okay, so if you have a lump on the right breast, more or less, I will think if it was me, is it cancerous or not? So you look at the breast, you see the symptoms of cancer. What are the symptoms of cancer? It can be there's a dimpling. So, tapos hawakan mo yung mass. So, kung yung mass is sobrang tigas, most probably, it's a symptom of cancer. Okay? Tapos, tingnan mo yung kulani mo. Kung nagkakaroon ka ng kulani, may kulani ka. So, that's another symptom of cancer. Pumapayat. So, pumapayat ka ba? Now, if you have a breast mass, okay, so, kasi maraming reason yun eh. So, kung hindi naman siya, kung wala naman yung symptoms na yun, most probably it's benign. Hindi siya masyadong nakakatakot. So, what you can do is that some breast mass, breast cyst, they're associated with the deficiency in iodine. So, the best thing that you can do is to eat a lot of seaweeds. Huwag ka din iinom ng masyadong maraming coffee. Kasi ang coffee, it depletes your iodine. So, babagsak yan. So, another thing that you can do is cabbage compress. So, you can do cabbage compress in your breast. So, dun sa mga tao na hindi alam ang cabbage compress, I did a video about that. So, you look at it. So, yung few leaves of cabbage, okay? So, ang gawin po nyo, painitin nyo lang po siya, lagyan nyo rin po siya ng virgin coconut oil, apply nyo lang dun sa dede. Pwede din po siya sa mga parts that are very painful. Pwede nyo rin pong ilagay doon. So, some people, they do poultice also of the cabbage compress. Ang poultice po, you just crush them in small pieces. Yeah, so maliit lang siya poultice and then you can apply it on the breast and hopefully it will go away. Okay? Hopefully. Yes. Next is Jolly Lim Cabrera asking, my husband is diabetic with hypertension. He's taking maintenance but I want him to take herbal plants. What can you advise? Thank you. Now, when it comes to synthetic medicine, okay, because I'm not seeing you anymore. Because I can't practice medicine. Because I'm here in the US. So, it's your decision. If it's your decision, if you wanna continue taking your synthetic medicine. No? Kayo po ang magde-decide niya, not me. Now, if you wanna supplement with herbal medicine, pwede din naman po. Now, the best herbal medicine for diabetic, it's insulin plant and serpentina. Damong Maria, maganda rin po yan. Chichirika, maganda rin. So also for hypertension, kasama na rin yan. Lemongrass, yan, maganda rin po yan. Garlic, ginger, yan po yung mga halamang gamot na makakatulong sa kanya. Again, like what I said, kapag gumagamit po kayo ng halamang gamot, you have to use it 5 to 7 times higher than the normal. Baka mamaya konti na naman yung ginagamit ninyo, tapos hindi rin naman siya effective. Going on the supplementation side, chromium. Chromium has been demonstrated to lower the blood pressure, the blood sugar. Also apple cider vinegar, it can help that. And of course, change your diet. Kasi ang diabetes, so that's a lifestyle disease. Oh, very dangerous ang diabetes, ha. It's one of the most dangerous diseases, man-made diseases. Kasi pwede ho kayo ma-atake, ma-stroke. Yung kidneys niyo pwedeng pumalya yung mga yan. So it's very important to address diabetes. Ano? Don't take it lightly.
Mitch Nagales Ignacio asked, what about plantar fasciitis? I can actually answer that one personally. Having suffered from that personally, change your shoes.
Yes.
Get a very, very comfortable shoe with a nice cushiony support.
You can also do Epsom salt bath. Okay, kuha po kayong 1 tablespoon not 1 tablespoon, 1 cup of Epsom salt, lagay nyo sa water. And then you put your foot there. So, pwede rin ho kayong mag-massage. You use virgin coconut oil with cayenne pepper. And then you massage it on the affected part. Yes. So, best cure for lymphoma, Doc. Ricky Russell case kasi. Yan. So, again, I already told some of the people that some types of lymphoma, leukemia, they are associated with magnesium deficiency. So, unang-una, kailangan kumain ka ng mga foods that are rich in magnesium. And these foods that are rich in magnesium, they're usually green leafy vegetables, yung kulay berde. Okay? Because they're one of the component of the chlorophyll. So, chlorophyll sa halaman po yan. That's how they make their food. So, it's because of the magnesium. So, you eat foods that are rich in magnesium. For the herbal plants, of course, you can use chichirika. So, this chichirika or vinca alkaloids, vinca plants, vinca rose, they are actually the chemo drugs that they are using. Right now, they got it from that plant. So, yung periwinkle. So, pwede mong kunin yun, all plants or parts. All parts, you can boil it, drink it 3 to 4 times a day. Also, you can try Boston C, Mega Dose Vitamin C, and Pixie Dust. They can help you. Okay? So, next.
Well, I was just looking at Alma Angeles Padilla. She's in the UK. And what she's asking for is, what diet can I have in moderation with rice? She's breast cancer stage 1 grade 2. Unfortunately, no rice.
No rice, ate. Yeah. But again, this is your decision, ha? I'm not gonna tell you if...
Finally chop up zucchini.
Yeah. But when we were in Phil, some of the substitute of rice that we have is zucchini. Yeah? We do zucchini, broccoli, cauliflower, yan. Pwede naman po yan ng mga substitute for rice. Okay? So, again, hello, Arlene Tukong saying hi, Doc. Yeah. So, next question. Yes.
Okay. Good evening, Dr. Farrah. Watching in Hong Kong, ask lang po, Doc, kung ano po ang body reaction if you're in oral chemotherapy. It's from De La Rosa, Valderrama.
So, depending on the chemo drugs that they would use, that's some of the effects you would feel. Ano? Hindi lahat ng chemo drugs that you will drink will have the same effect. But majority, it's like this, okay? Pwede rin hong malugasan ng buhok. You can also have hair fall, okay? Your nails may also die. Yeah, same as IV chemo din ho ang side effect niya minsan. So, pwede rin ho kayong pumayat. Yung skin ninyo yan, pwede hong madisgrasya yan. Kasi ang oral chemo kasi, or chemotherapy, IV chemo, they usually attack the multiplying cells. So, the fast multiplying cells, katulad po ng skin. So, usually, kaya nakikita nyo nangingitim yung mga pasyente, ano ho? Because that's how they attack first, the skin, yeah. Multiplying, yun po ang tawag nila, multiplying cells.
Ling Kalumpong Quibs is asking because she was her sister's a nurse in New Jersey, and she's asking about losartan for high blood pressure because obviously they are now promoting widely, which you have been saying for years, that losartan carries significant cancer risks.
Yeah, not only losartan, also ranitidine. Ranitidine, Zantac. Di ba? Nakikita ninyo. Here in the US, there's a lot of medications that they are recalling right now.
A lot of lawsuits, class action lawsuits against these medications.
Yes, ano, dinidemanda nila yung mga pharmaceutical companies here in the US.
And they pay a fine and go on business as usual. So what would you recommend to her? What would you recommend rather for high blood pressure and heart enlargement?
Ito po, nasagot ko na. I already answered this question, but I will answer it again. Garlic, ginger, lemongrass tea, yan po. Tapos pixie dust, yan. Maganda po yan sa puso natin. Now, if you really want a detailed answer to this, kasi nasagot ko na po siya kanina, so just, if you're watching, you know it already. So, check nyo na lang po siya. No, ha? Thank you. Yes, Digna Alejo Gomez asking for pampatunaw ng liver, tumor liver. Tumor, yeah. So, if you talk about tumors, generally in medical terms, tumor means just an enlargement, ano po, like a new growth, yun po. So, it doesn't really tell you if it's cancerous or benign. So, pagka may mga tumor, pag may mga enlargement po tayo or tinatawag po natin na new growth, so maraming dahilan, okay? So, you have to ask your doctor first, what's the most common reason bakit nagkakaroon ng tumor mass, ano? One of the most important risk factor of developing liver cancer, it's hepatitis B. So if you have hepatitis B, you would usually have, you would develop liver cancer eventually around 200 times higher. 20 to 200 times higher. So, kapag nagkaroon ka ng hepatitis B, almost always nagkakaroon din sila ng liver cancer, di ba? Nakakatakot. Also, if you are drinking, so if you're a chronic alcoholic drinker, and some medications also that you are taking in, some medications for the that you are taking in for maintenance, you would also develop some types of liver tumors.
Well, there's no medicine, no medication that doesn't have a side effect.
Yes, parasitic infection also. Pagka meron ka mga schistosoma, yung tinatawag po nila. And you can also develop some form of, or amoeba. Yeah, amoebic. Yan, pwede ka rin magkaroon ng tumors because of this condition. So, what you can do is that, as a herbal, in herbs, you can use garlic. Yan. Pinakamaganda ho dyan, garlic dandelion. Yan, mga milk tea, magagandang herbs for the liver. And of course, mega-dose vitamin C. That's what I usually do, especially if there's a damage in the liver. The mega-dose vitamin C will help you a lot. And garlic. And then, if it's damaged, you do an SGPT, SGOT testing after 1 month. So, you see if there's a result. Yeah. Hello, Miss Mimi! Yes, Miriam from Zen, Canada. She's gonna be coming and visit us.
She'll be visiting us here in a couple of weeks.
She's gonna visit. Yes, Henry's excited. Yeah, because she wants her big toy. Yeah, he wants his big toy. Yeah.
Rosemary
Henry.
Mamaril watching from Istanbul.
Yes, Istanbul.
Constantinople.
Yeah.
Okay, and
That's
she
one
says,
of your favorite
I like that song. Herbal for
goiter. Yeah. Again, if you have a goiter, it doesn't mean if you're hyperthyroid, hypothyroid, or euthyroid. So you can have, it just means that it's an enlarged thyroid gland. So, you have to do your TSH, T3, T4 testing. So, yun po yung una nyong gagawin. So, kapag hypo po kayo, Hypo, you can use seaweeds. If hyper, you can use cabbage. Yan. So, you can also, as a topical, you can also use cabbage compress. Pwede din po yung potato compress if you are into herbal remedies. Or you can drink guyabano leaves and damong Maria leaves. Yan po.
Thank you, Silvasana. Right now, I'm drinking my pixie dust while watching you live.
Yeah, so Tara Bansh is saying, if Doctora does not get your question, join her support group. It covers all illnesses, not just cancer. Cancer patient support group. Yes, thank you for reminding me, Miss Tara Bansh.
Nice Easter.
Yes.
I saw Aiden Flores a short time ago as well. I want to make sure I gave Aiden Flores the next show.
Of course.
I cannot read that one, Mommy.
Yeah, Sir Jack cannot read Tagalog that much.
I'm not so good.
So, Rowena Repil Pasana is asking, Dr. Farrah, laging sumasakit yung tagiliran ko sa kanan. Here on the right side and at the back of, at her back, likod ng balakang. So, usually, so that's the flank area, yung tinatag nating flank area. Ito po, yung sa ating pong abdomen, tas dito banda sa may front, tsaka dito sa may likod. So that's a part usually if you have urinary tract infection. That's the one that's really painful. Okay, there's a when I do my physical examination, we usually punch at the back. And then when it's painful, then that's one of the most probably you are having a urinary tract infection. You can have a UTI, you can have asymptomatic and symptomatic symptoms. For the symptomatic symptoms, you will have difficulty of urination, blood, dysuria, di ba? Masakit. Doon sa mga nagka-UTI na. Now, minsan naman, if it's asymptomatic, just masakit lang, okay? Or you can also have scoliosis. That's also one of the condition if your back is painful. So you have to really make sure if it's, you have to rule out if it's a UTI or baka back condition lang siya. So what you can do is that, of course, lemongrass. Yeah, lemongrass tea. That's one of the best. Parsley, cherry juice. Yan. Cranberries. Yan. Maganda ho yan. And then garlic, ginger, of course. Those have an antibacterial property. So maganda po na iniinom din po ninyo. Yes.
Ranitidine gamot po siya sa Anopodoc.
Yeah, ang ranitidine, it's a medication for GERD, for acute gastritis. Yan. So they are being recalled here in the US. I don't know if that's being recalled in Phil. Yan. So si Sir Jack, Sir Jack gave me the
What do you think? You think they're being recalled?
He's giving me the So I don't know if that's happening. But I think when we were in Phil, they did recall losartan. Yeah, I think they did recall losartan.
I think due in large part to the significant amount of pressure you were putting on them.
Yes. But if you're gonna ask me, because I'm a diehard herbal scientist or herbal something. So for me, okay, because I really believe in herbal medicine. For me, this is just my personal opinion. I would stop it. It's just my personal opinion.
If it were you,
I would stop it. I would stop because I'm into natural medicine. Kasi kung hindi siya effective, di ba? Because I really believe that herbal medicine is effective. So, bakit pa ako iinom ng synthetic, di ba? Kung naniniwala naman talaga ako sa natural medicine. So, kasi yung iba takot tanggalin, di ba? So, bakit ibig sabihin hindi ka talaga naniniwala. For me, that's just me. Okay? So, huwag kayong magalit. Huwag kayong magagalit sa akin. Okay? So, yes. Lori Garcia said, Doc, breast cancer nagmetastasis sa liver. Ano po ang dapat gawin? Di po nagpa-opera and chemotherapy. So if the cancer went to a different part of the body, okay, because the cancer can go to the lungs, they can go to the liver or to the bones or to the brain. So that's already considered stage 4. Yan. And sorry to say, if you are stage 4, it's more difficult. But it doesn't mean that you're gonna die. Okay, huwag niyo pong isipin na kapag stage 4 ka na, wala ka ng pag-asa. No, there's always a chance. And I see tons of people who are stage 4 who got better.
You've had more than we could count.
Okay, so for me, I would take Boston C, Megadose Vitamin, Pixie Dust, dietary modification, of course, that's very important.
Lifestyle modification.
Yeah, and pray. Always, sa akin, important kasi sa akin ang prayer. Because, for me as a medical doctor and also as a Christian, Jehovah's Witness, I believe that Jehovah designed the kingdom for me where there's no pain, there's no suffering. So, that's the place that I look forward to.
Correct.
Yeah.
And just to basically kind of expound upon the science of what you do with herbal medicine, Mom, one of the things I wanted to point out is PTAC, which is part of the Department of Health, which is the Philippine Institute of Traditional and Alternative Healthcare, has actually produced thus far 2 encyclopedias of medicinal plants of the Philippines.
So if you're interested, you go to PTAC, yes, to Miss Annabelle Fabiona. So she's the director of PTAC, okay? That's a government, that's part of the Department of Health, yeah. Whom I won against. Yeah.
Yeah, so we're
but I'm still promoting.
Beat the
them.
DOH and promoting their books.
Because they're promoting herbal medicine. So, pwede nyo pong tingnan yan, nandiyan naman lahat, cytotoxic activity. So, this is produced by the government of the Philippines. So, tingnan po ninyo, yan. Oh, bili po kayo. I think this is like 1,000 pesos for both.
Like
yeah. Just correct me, Attorney Marife. Hindi ko alam.
You can get them at PTAC.
But it's good. It's good because they will tell you also the compounds sa mga chemist. Yan. Sa mga chemist, makikita niyan.
So these are very, very good for a person all the way from the lay person up to a clinician. And so, we're really, really happy to have worked with PTAC as far as these things are concerned.
Diba? So, kita mo naman. Ang ganda naman, oo. Kudos naman to PTAC. Okay?
Oh, yeah.
It's very good, Oh, diba? Yung mga, dun sa mga hindi nakakaalam. Yeah. Let's support our government.
And this is filled with scientific studies demonstrating the efficacy of Philippine medicinal plants. This isn't something that someone pulled out of the air and said, well, I think I'll try this, or I think this will work.
Ate Lily Diego is asking, what's the name of the book? It's Encyclopedia of Medicinal Plants of the Philippines, Volume 1 and Volume 2. Yan. Nandyan lahat. Oh.
Hold it up, Mommy.
Yan. Nandyan lahat. Oh.
Hold it, wait, hold it up so everybody can take a screenshot. Okay, take a screenshot now.
Ayan po, yes. You can call PTAC. PTAC, P-I-T-A-C-H. Is that?
HC.
HC, PTAC.
P-I-T-A-H-C.
Okay, I don't know. So, ayan. So, punta kayo sa kanila, sabihan ninyo. Kasi maganda, as in. It's, for me, if you're very interested in
fantastic source of information.
Oo.
Fantastic source of information.
Yeah. So, support din natin sila. Okay. Kasi gobyerno natin yan eh. Yes!
Just because somebody did something wrong to us long ago, we don't have to hold grudges.
Yeah. So, yeah. I forgive you. Sir Jack, I don't know if Sir Jack forgives them.
Well, there's a difference between holding a grudge, Mom, and forgiving.
Yes. So, Pilar Marie Garcia is saying, is it true that ginger ale helps with acute gastritis or acid reflux?
That's what my mother always prescribed when I was a kid.
I don't know what's in ginger ale.
That was the home remedy my mother always gave us when we were kids.
Yeah, I don't know what's in ginger ale, okay? I will personally
nowadays
tell
it's a whole lot of sugar.
Yeah. Yeah. No, CH. Sir Jack said. PTACH. Oh.
No, healthcare. Philippine Institute of Traditional Alternative Healthcare.
Okay. HC.
PITAHC.
Pareho tayong mali, Ate Glinda. Yeah.
Almost.
Okay. So I don't know what's in ginger ale, but Sir Jack said that because his mom his mom is a nurse. He's a nurse practitioner.
No, registered nurse.
Yeah, registered nurse. Mm-hmm. So, that's the one that his mom would usually give him.
Oh, yeah.
Yeah, but kami sakit.
Is brown rice good to consume every day?
if you do not have any
for who?
cancer, no, if you do not have any cancer, you can use brown rice. Yeah. Kasi tayong mga Pinoy, di ba, hindi kompleto ang food if we do not have any rice. Especially Filipinos.
It is a third world country, I understand.
Yeah, so it's like you're telling us, you know, we're gonna go to war.
Give me rice or give me death. Right, Mama?
Yeah. Okay, so Karen Ann Reyob, yeah. Thank you, Miss Karen.
Thank you for sharing the website for
PH.
PTAC.
Yes. Yeah.
PTAC.gov.ph.
Punta ka doon. Yeah, so okay naman sila, you know, PTAC has been when everything, I wish they would have done much more, but they're okay. They're okay.
Well, they had a lot of pressure on them as well.
Yes. So Tara Bunch is saying, my book is still available at National Bookstore. It's still the #1 book for almost 1 year now. Thank you very much po. And then I hope that my second book, that you will also support it. Thank you po. Mas maganda po yung second book. Kasi second book, there's...
Yeah. Just remember, when you get sick, you cannot get healthy with the same diet that got you sick.
Yes, okay. Yeah, so please, second book ko, it's almost there, but it's more informative. Yes.
It's a good book.
Yes, it's a good book. Yes. Okay, so thank you very much for watching us. And,
wait. Just answer a few more questions, Mom. A few more questions. Couple more questions.
Okay, Sir Jack is saying a couple
more
questions. Can I avail the book po here in UK? Unfortunately, you can. Unfortunately, it's not available, but you can private message.
Yes,
Miss Chi Balmaceda Gutierrez. Yeah.
Deborah Sue's asking, will America be able to use our new book? Yeah, we'll try.
Yes, we'll try to have some of it printed here or sent it here. Hopefully, Miss Deborah Sue. Miss Deborah Sue, you know, I really appreciate you. Yeah, I'm seeing all of her posts about Dr. Farrah, and I really appreciate it. So thank you very much.
From Joe, well, Doc, is it true that one of the reasons to have high blood and diabetes because of having abnormal liver function?
I don't know the answer to that question.
That's an unusual question.
But that's a great question.
It could play a role?
It can play a role, but that's a great question. And I'll do my research. So I can give you, I'll give you a correct answer. Yeah, but that's the first time someone asked me that question. But that's a great question.
Excisional or fine needle biopsy, which is safer, Doc?
Biopsy. What is that?
Asking excisional or fine needle biopsy, which is safer?
Well, I'm against biopsy. I'm so sorry po, I'm against biopsy. But if your doctor is very good, if he has seen a lot of cancer, they would know. They would know just by looking at it. Like our friend, we have a friend here, and she had some cancer in oral cancer. And
you were telling her for how many
months? I have
months?
been telling her that's cancer.
And her doctor said, no, it's not.
No, it's not.
For how many months now?
I
her doctor said, no, it's not, no, it's not, no, it's not. You're saying, that's cancer.
I said, that's cancer. And guess what? They finally said, it's cancer. And she was telling me, but Farrah already told me that it's cancer. Yeah. So, but I've been telling her for a long, long time. I said, I've seen cancer, I've smelled cancer, I've touched cancer, and I know that's 100% cancer. And I was right. And if you have prostate cancer, how would you know? Your doctor can feel it. If the prostate is hard as rock.
It's not pleasant, by the way, getting a prostate exam.
Hard as rock. It has to be hard as rock. That's cancer. If it's like this, if your doctor feels it like this, like soft, then that's not cancer. But if it's hard as rock, that's cancer. 100%. Yeah. He will know. But me, I do not advise a biopsy because if you once you touch it, there's gonna be a leakage of cancer, and it can be a precursor to metastatic spread. Yeah, that's the reason why I do not allow it.
No, just imagine you take a water balloon and then you stick a needle in it. you know, is going to leak.
It's gonna leak. So that's my take on it. Yeah, and we studied it. I studied it, so I know that's why I do not allow some of my patients when I was in field to not do it. Yeah. So what do you recommend for losartan substitute? Ate Mina San Miguel said, please watch the video because I already answered that question. Yes.
Hopefully the replay won't have all of the interruptions. There have been 50 interruptions this video.
Okay. So that's it. Thank you very much for watching.
Thank you for joining us.
Yes. Bye-bye.